Hi, my name is Dr. Karl Yousef, and I'm here to break down what to expect in the emergency department when you come in with vision loss or eye pain. I'll walk you through certain things your doctor may be thinking about, and afterwards, I'll explain certain labs or imaging that you might receive. Depending on the complaint, we'll finish with some potential outcomes to expect if your doctor sends you home. Remember, in the emergency department, we don't just look for what is going on, we look for what isn't going on. What does this mean? It means that as emergency doctors, we always have a mental list of scary diagnoses that we have to make sure are not happening to you. So, even if we don't find the exact diagnosis within one ER visit, our goal is always to rule out big, bad, and scary things. As you go through your workup, remember that even if you don't see your doctor for some time, they are always following your results in the background. So, you're coming into the emergency room with vision loss or eye pain. Here is what your doctor is thinking. If you've got vision loss, your doctor is thinking, could this be a general stroke or a stroke of a blood vessel leading into the eye? Let's review what a stroke is. A stroke is when there is a blockage of one of the blood vessels going into a part of the brain. This includes the eye. Without adequate blood flow, the tissue in that specific area will begin to shut down and ultimately die. Now, I'm not trying to scare you, but this is something your doctor is always thinking about if you're having vision loss. Your doctor is also thinking about many other causes, such as bleeding within the eye, called vitreous hemorrhage, or even separation of the skin inside the eye from its own blood supply, which is called retinal detachment. Additional considerations include any issues with the optic nerve, which is the main nerve transmitting visual information from your eye to your brain. Increased pressure within the eye, known as glaucoma, is also on your doctor's mind. Your doctor is also considering both bacterial and viral infections around the eye, within the eye, or on the eyelids. These infections have names like cellulitis, conjunctivitis, or a stye. If you're having eye pain and have also experienced any injuries to the eye, your doctor is thinking about bleeding behind your eye, which can put pressure on your optic nerve. Additionally, after a direct injury, your doctor is considering any foreign bodies which may scratch the cornea of your eye. This is known as corneal abrasion or corneal laceration. This causes severe pain and can sometimes cause difficulty seeing, and can even puncture into the eye, causing the need for surgical removal. Sometimes your emergency room doctor may be able to remove this foreign body if it is still present on their examination. Please be aware that there are many eye conditions and that these are just a few of the things your doctor is thinking about. Depending on your doctor's judgment, your doctor may begin the process of looking for a stroke, which may involve blood work and possibly a CT scan of your head, or your doctor may notice that your problem is a result of a direct eye issue and may do specific tests on your eye. If you've had an injury, this includes putting a yellow dye into your eye and looking at it with a special blue light. Don't worry, you'll often get a numbing eye drop before this. Your doctor may also test the pressure within your eye to make sure it's okay. They'll use a little device that quickly touches your eye to check the pressure. This is usually tolerated pretty well. Your doctor may also use an ultrasound machine to take a look inside your eyeball to look for bleeding within the eye or detachment of the retina. Again, depending on how worried your doctor is about other issues, they may also get blood work and various types of CT imaging. After some time, your doctor will explain your results to you. If your doctor is recommending that you stay in the hospital, it could be for additional monitoring, or it could be that your doctor found something that needs extra attention. In either case, your doctor will explain to you the reason for keeping you in the hospital. Finally, if your symptoms improve and you're being sent home, I'm happy to hear that. Make sure to follow your doctor's recommendations, and if your symptoms are not improving or are getting worse at home, we always encourage you to come back to the emergency department to make sure nothing was missed on the first visit. If your doctor recommends following up with an ophthalmologist, please do this. Your eyes and vision are not something to take lightly. I know that being in the emergency department can be an incredibly stressful experience, and I hope this is helpful for you. Again, this is Dr. Karl Yousef. Wherever you are, we care about you. We work hard to make sure that you're okay. While you wait, feel free to subscribe to this channel for more medical information from a board-certified emergency doctor. You can comment with video ideas that you want me to cover, and I'll take the time to reply to you. You can even watch some of the other videos on this channel for entertainment. Thank you for your time. I'm wishing you the best in your health.